afternoon. Dear viewers, and welcome to another episode of Dr. D52. So thank you for joining today's webinar. And to continue our theme of Wearable April and the very last webinar, we're saving the best for last. And as healthcare professionals, managing stress effectively is very crucial, not only for our own well-being, but also for the quality of the care we provide. So today we're very excited to introduce you to TouchPoint. This is a wearable device that's non-invasive and non-pharmacological solution. It's a very innovative solution designed to alleviate stress and also to support therapy, especially for pediatrics in ADHD and ASD. So TouchPoint's unique technology offers a very straightforward wearable approach to stress management. And its claim is that it's helping users to achieve a very calmer state of mind very quickly and very effectively. So to bring our distinguished speaker today, we have invited the Director of Research and Development for the TouchPoint Solution, Dr. Nathan Hageman. He's a distinguished neurologist from the US and also personally involved in a TouchPoint technology breakthrough and research. So without further ado, let's open the table to Dr. Hageman. And, how are you today?
Great. Thank you very much. I'm doing well. Thanks.
Awesome. Yeah. How's weather in San Francisco?
Oh, it's actually a little bit rainy over here, but that's usually the case in San Francisco. A lot of rain, but it's
Thank
nice.
you for joining us, so late at night and taking
no
your
problem.
time out of your busy schedule. So how about I leave the floor to you?
Sure. Thank you very much. So, well, I'm very excited to discuss this device with you. My name is Nathan Hageman. I'm the Director of Research and Development for the TouchPoint Solution, which I came on board with the company about 3 years ago. I've helped both develop and continue to develop the original design of TouchPoints, as well as some of the exciting things that we're doing now in the future. So TouchPoints is as I said, is a wearable general wellness device for stress reduction. And so I'm excited to bring that to you guys today. So let me just go forward here. So basically, I want to do three things, go over three things today, both what TouchPoints are, how they work, and then some of our research studies, as well as some of the clinical applications we have to that. So what are TouchPoints? Well, before I get into that, just some basics of stress, which I'm sure you all know. We all know that stress is, especially chronic stress, is bad. It's actually, the stress reaction is actually it's a useful reaction in the short term, but chronic stress, as we know, is bad for health, both in terms of physical health as well as psychological problems. And these are mediated by both neural and hormonal mediators. Specifically, an example of one is cortisol, which is a major stress hormone. And we have found that to be a good objective metric in anxiety. As you'll see when we do our research studies, there's going to be those studies. We have a lot of subjective sort of measures of stress, but we also are able to do some studies and have done some placebo-controlled trials using some of the more objective metrics of stress, which are more useful and I think more compelling. So, stress itself, many diseases are linked to excessive stress, and also linked is an increased mortality risk over time that from things such as cardiovascular disease, diabetes, and even some comorbid psychiatric conditions like depression and anxiety. The stress manifests itself in many ways, but obviously you can divide those into two things. We've had most emotional consequences of stress, such as just feeling tense, or that kind of sense of dysthymia or dysphoria, and then also sort of the physical manifestations of stress, such as the stomach tightening, increased heart rate, sweats, and also other things which are not so much fun. So the burden of stress, of chronic stress on both America and across the world is pretty significant. We have in America over about 40 million Americans suffering from some sort of anxiety disorder. 115 million of adults have experienced some stressful event in the last year. 80% of workers feel stressed when they're on the job. And there's over $1 billion annually spent on anti-stress medications. So our solution, as we developed this product, was to bring to market a fast, effective, wearable device that can reduce stress in a non-pharmacologic way. And there's benefits for that because we can add this to any sort of therapy. You can add this to any sort of therapy you have for your patients without worrying about medical contraindications or interactions with any sort of treatment regimen. And this is also a self-directed device, so that people who are people who are stressed and they have this device, they can and then use it on their own and definitely feel empowered with as they kind of take charge of their own treatment. Let us go. So go a little bit into more detail of these. These devices are are wearable devices that kind of deliver a somatosensory stimulus, basically a vibration, in a alternating pattern. So in that case, there is because of that, they do need to be worn. Can be worn on any part of the body, but they do need to be worn on alternating sides. So you can do things like on the wrists with we have like wristbands. You can put them on the legs and the socks or the ankles. You can put them on straps of a bra or a top. You can put them in pockets, in palms, and even we have zippered sweatbands where you can put them on as well. So many different ways to do it, but one of the requirements is that it has to be on alternating sides of the body, because one of the parts of this that makes it work, that mediates it, is that bilateral alternating pattern of stimulation. So we have several different products from TouchPoints and have kind of expanded our line from things such as the original TouchPoints, just for calm, for the reduction of stress. We've also found that TouchPoints have been effective in sleep and sleep disorders. We have a set of TouchPoints available for kids. And then also, as I will mention toward the end of the talk, we have a new device we're doing in development, which is taking TouchPoints to the next step as a wearable that is integrated with an app and a stress and assessing stress through heart rate variability and AI-based approach. So just to kind of, how do TouchPoints work, right? So to do that, to answer that question, I'm just going to take you a little bit a review of what you probably guys all know, but just quickly overview. So homeostasis, which is wherever we are in our day or with respect to stress, is a balance of two different parts of our autonomic nervous system. The sympathetic division, which is that fight or flight reaction to a threat, or that that sort of the reaction to a threat, and or the parasympathetic activity, which is more of the rest and digest part of our nervous system. So wherever we are in the day, it's a balance between these two branches, which are mediated by both neural and hormonal parts. That is sort of a lower part of the brain with respect to stress. TouchPoints also affects, we say, higher cortical centers or higher parts of the brain with respect that are implicated in stress and even PTSD, such as the hippocampus and the amygdala and the prefrontal cortex, which create sort of a balance and an integration of sort of these sort of traumatic memories, which can be sort of incorrectly encoded in the lower parts of the brain, specifically in the amygdala and the limbic system. And then the TouchPoints, as I'll go over, helps to kind of rewire these parts of the brain to create more widespread cortical connections and inhibition. So TouchPoints basically is these wearables, which can go around your wrist or both in parts of your body, basically work by delivering what we call blast, which is a bilateral alternating stimulation, pattern of stimulation, and basically a vibration that is gentle and non-pharmacologic and non-invasive. This reduces stress in two ways. We've just discussed about sort of the autonomic nervous system. Blast has been shown to increase parasympathetic tone. So much like vagal stimulators, things like that, this device will increase sympathetic tone, sort of terminating that very quickly and effectively, sort of terminating that stress response and reducing somebody's stress down to stress response more down to normal levels. It also affects these higher brain centers because blast is based on a psychotherapeutic technique called eye movement desensitization and reprocessing, or EMDR. It's a psychotherapeutic technique that's been around since about the 1990s. It's been used to treat PTSD very effectively. So how does EMD therapy work? And that this is based on? Well, again, as I've mentioned, these sort of higher brain centers, EMDR therapy will actually reduce sort of the lower brain or the traumatic parts of traumatic experiences of any sort of traumatic memory. Specifically, when somebody has PTSD or traumatic memory, it is said that they kind of relive their experiences instead of remember them. These things have been implicated as being sort of re-encoded or improperly encoded in sort of the limbic system, much like the amygdala and hippocampus and sort of those lower sort of subcortical structures. How EMDR therapy is thought to work is to take those incorrectly encoded memories and establish more widespread cortical connections, such as with the prefrontal cortex and other sort of parietal and occipital parts of the cortex. Really, and those tend to be inhibitory downward connections, and so give sort of an extinction of that traumatic or overreaction response by the lower brain centers. And in essence, we can think of it as sort of being able to kind of connect with sort of your more rational parts of your brain. So if a traumatic thing happens, such as a car wreck or car crash, a person obviously can get PTSD from that. And this would be, these kind of cortical connections would be quite those sort of rational parts of your brain that would say, okay, well, I know that if I'm going to get into a car, I'm not going to have an accident every time I go out on the road. Those EMDR therapy helps to establish that and sort of bring that sort of level of heightened awareness or heightened arousal down very effectively, actually. So that's kind of how TouchPoints will work. We do it. It's very kind of simple. We use by using these bilateral stimulation, the somatosensory vibration on both sides, alternating sides of the body, much like EMDR does, with either a visual stimulus or another somatosensory stimuli. This reduces both the sympathetic response as well as creating sort of those widespread cortical connections, which can reduce that level of arousal. And over time, actually, what makes TouchPoints so great is that this is a permanent effect. So we often see somebody, although this can cause relief or give relief in about 30 seconds, we see after repeated use that patients will eventually actually maybe not need our device. Certainly we see that extinction level, much like EMDR therapy, kind of go down and to sort of baseline levels. So I just want to take you through this last part of the talk. I just want to take you through the research studies that we have and that kind of proves all this and supports our claims. So we have multiple studies that we've done that have been published in peer-reviewed journals, both showing subjective, and we'll go through each of these, but both showing subjective reductions in both emotional and psychological effects of stress, as well as objective metrics of stress. I mentioned cortisol, and that's the basis of one of our more powerful studies, which have shown not only a reduction in subjective ratings of stress, but also in cortisol sampling, salivary cortisol samples. So, and then I'll also present, a kind of a case study which shows some of the EEG effects that we see after TouchPoints application. So the first study I'll go through here is just published research on just the therapeutic effects of a large cohort of patients, of actually customers and users of TouchPoints who would basically responded with a subjective rating for individually the emotional components of stress and the physiological symptoms, both before and after application of TouchPoints. We used a Likert scale from 1 to 10, 1 being the no stress, 10 being the worst stress in your life. And what we saw was, then I'll come back to that one. What we saw is a reduction in the subjective stress by before and after blast by definitely by a statistically significant amount. And then also a subjective rating of the bodily or physical distress that people experience before and after TouchPoints with stress. So both these were compelling in a sample of about 1,100 subjects. So statistically, this was a powerful study. But one of our more compelling studies was this triple-blind, placebo-controlled, randomized clinical trial that we did in subjects looking not only at subjective ratings as we did in the previous study, but also salivary cortisol levels. And if you can see these graphs here, these arbitrary units are again these in this case on the left graph, we're looking at the subjective ratings of stress, again on that Likert scale from 0 to 10. And you see this first trending downward, which is both the red is the placebo and the blue is the active, or the people who were actually using TouchPoints. And you see these, of course, being about the same, both in the recruitment and the baseline, and then after arrest. And then after we present them with a stressor, then we begin to see the separation here, and it's statistically significant separation. And we see in the placebo, of course, this rise back up to baseline levels. And in the TouchPoints group cohort, we see a significant reduction of stress levels. Again, after both right after this test, and then again as we go down after the rest. So if you look at this same cohort, when we looked at both baseline and salivary, these are cortisol samples, salivary cortisol samples. You see this red line again, the placebo, and then again showing at baseline, and then after the increase that you see after the presentation of the stressor. And actually, this is quite compelling, showing that after TouchPoints, we see immediately after the stressor, actually a trending downward, and statistically significant trend downward in salivary cortisol levels. So I just want to present also a case study, although we're currently in doing a more widespread case of this, which looks at quantitative EEG in a single subject, showing brainwave activity after applying TouchPoints for stress. So again, many of you, of course, know EEG by fixing electrodes to the brain. These will capture electrical signals, mostly cortical electrical signals, not so much subcortical, over the entire area of the brain. Good temporal location, fairly not great spatial localization, but we can see we will see this kind of a compelling result here. So and basically that result is here is a baseline, and what we see, this has actually been beta activity. So these kind of representation, graphical representation, sort of the brain, electrodes spread across the brain. We see after stressor in the control subject, we see significant increases in beta wave activity, which is corresponds to sort of stress or those kind of, well, definitely stress oriented or stress associated brain activity. And then the actual in the subject here, again, after presentation in the stressor, we see after touch points not only a reduction to baseline levels, but actually a downward trending again in beta activity. What we see is actually, although not present here, we see actually a increase in theta wave and delta wave activity, which is more, and those kind of patterns which you see in deep sleep or meditation. So again, this is why TouchPoints is so effective we found they're so effective for sleep, both in kind of extinguishing, both in getting people to sleep faster, as well as less wake up events, or less more deep wave and slow wave sleep through the night. So, TouchPoints is also, although we are a general wellness device, and therefore are not intending to treat any of these disorders, we have found TouchPoints actually to be very effective in the treatment of several comorbidities or other psychiatric conditions, especially in kids in terms of the ADHD population and the autistic population. And again, I'll be happy to discuss more of that in either offline or in the question and answer period. But I just wanted to present one case, which we have a case study where we're looking at in patients with ADHD, looking at symptom severity, using this sort of rating of ADHD symptoms called the Pearson quotient device, before and after applying touch points. And this device looks at both is a kind of an automatic or sort of standard clinical attempt at a standard clinical rating of symptom severity in patients with ADHD, targeting both attention as well as hyperactivity. So, and we can get ratings of each of these. So we saw in a patient, this 13-year-old boy with ADHD demonstrated both an improvement in both attention and activity during while using touch points. So again, here's the control using this device, where these kind of devices are done over this time period, and showing both ratings basically by affixing sort of a metric to the head, so that you can track eye movements as well as head movements. You can kind of gauge symptom severity, and has been shown to be correlated to that in the literature. So you see this, again, this control, see, again, this person, this 13-year-old with ADHD is impulsive, distracted, disengaged. And then after the application of touch points, almost within 30-second increments, without just 30 seconds of of application of touch points, you can see that this improved attention coming back into almost near the baseline, or near the normal for their age and sex. So we've seen this across numerous occasions. And again, this is another study we have currently going, which we hope to publish soon. So again, yeah, sorry. This showing this subject's accuracy, both, again, motion capture, through this motion capture before touch points and then after touch points. So I just want to say we also have had some, again, I did mention it just for the brevity of the talk, but we have seen this being effective in autism as well, both in the self sort of as in the autistic patients themselves, basically by assessing self-harming behavior, a reduction or even an abolishment of that, and then also that's what makes these devices so good. We also have seen it effective in the caretakers as well. So this is something you can give both to your autistic patients as well as the caretakers, as you know, there's quite a burden of stress on the people who are taking care of a patient who's autistic. And this, you can give these devices to your patients as well as them people who take care of them, and they can be added to any sort of treatment regimen you have going without a problem. They're non-pharmacologic, they're non-invasive, and have been shown to be very effective, although not intended to treat those disorders, have been very effective in reducing symptom severity, probably through reduction of stress mechanisms that we talked about earlier. So, okay. So, again, today, just going over what we did when we went over, this is just presenting this sort of TouchPoints device, this wearable generalized wellness device that we have for stress reduction. And this works by, again, the self-directed application of this bilateral alternating pattern of stimulation, which both increases parasympathetic tone and also creates these new rewiring of these traumatic or stress triggers, and creating sort of that kind of bringing in that sort of more widespread cortical downward inhibitory connections. And then we've seen, of course, that presented that TouchPoints has shown not only efficacy in generalized stress reduction, but also in many specific conditions such as ADHD, autism, Parkinson's, as well. So anyway, I want to tell me, please, all of you, if you can, follow us on the web. We have a social media account. This is our, again, I can give these connections or these links to the DocWitty Greet team, both because we're on Facebook, we're on Twitter, Instagram, and we have our website. And the DocWitty team will also, I was told, will have more information. Of course, you can, I'll leave my contact information with them if you have any other questions. And of course, they also present a way to order your own set of TouchPoints for yourself or your patients. We are big believers in this product, and hope you can use it and see how great it is for your own patients and yourself. So I want to thank you. I also want to thank the people who present this channel as well for inviting me. It's been a great experience, and I've been very happy to present this to you today. Thank you.
Thank you very much, Dr. Hageman. We have a few questions on the floor,
Sure.
And I have some personal questions as well.
Sure.
Just understanding the product synergy with EMDR, as the therapy is just taken off in this part of the world, as we have been traditionally very slow on trend. How is it applied, and how does it complement each other on a day-to-day practice?
Right. Yeah. So often EDMR therapists, we've seen this to be very effective in both in treatment of during the sessions, as well as this is a device you can give to your patients to when they're out of a therapist's office. It's a self-directed method of treatment, and can sort of augment your therapy. We've seen this reduce the number of sessions needed, as well as bringing those traumatic stressors sort of down to that sort of level, sort of baseline level, quicker by weeks sometimes. So,
I see. Another question is the go-to-market strategy, on the USA side. So this product has been available for a couple of years in the USA, and just understanding, like, what is the traditional channel route other than direct online sales? And I have seen a couple of influencers on YouTube, sharing the experience of this product. I just want to understand on the HCP side, has this been adopted, and does it go through the traditional hospital channel as well?
Yeah, actually, although our director of marketing could answer this question better, but yes, we have sort of wholesaler and therapist sort of relationships we've developed. Again, I'm sure that we would love to develop with anybody interested in your area as well. And that's sort of given these patients, you can order these devices both for you and your patients as well in bulk at a reduced price, not a retail price. So.
Right, I see. And do we have any plan for this product to become a medical device in any point in the future?
We do. We actually are. I know it's America. It's American, but we are in current kind of trials with Medicare and Medi-Cal to try to get Blue Shield as well to try to get this covered by insurance. I know that's a problem in America, but also we also are developing this new product, which is their next sort of iteration of this. I didn't
Right.
discuss that too much, but that's the AI based automatic sensing stress management based on heart rate variability. So we're excited about that as well, which should be releasing hopefully this year or next year.
Awesome. Because like this is usually the first question that's come up in this part of the world. Like FDA carries a lot of weight
Mhm.
in this part of the world, and there's a distinct difference between a wellness device slash a medical device.
Yeah,
But then again, there are obviously pros and cons.
yeah,
Between two markets. Like we can't openly, promote medical device products online, etc.
yeah.
Whereas this device probably doesn't seem to have the problem. So.
No,
Uh,
yeah,
yeah, I have some questions in regard to pediatric applications,
sure.
especially the ASD and ADHD aspect. Like again, like back in the EMDR therapy, like how does it complement? Like, does the therapist usually use them in conjunction to the therapy that's already being received,
Yeah,
or
yeah. So,
yeah,
yeah. So in you know that in obviously a challenge in sort of both the ASD ADHD crowd. You have your mainline medications as your methylphenidate,
yeah,
sort of, Ritalin, drugs like that, first line drugs. But again, and any sort of anti stress medications which you can add on top of that, such as um, even benzodiazepines or other tranquilizers, which are not ideal and carry their own problems. This device, we've found that you can add this device to both EMDR, if any EMDR treatments, but also any pharmacologic treatments that you have going on without a problem because it is non-invasive, non-pharmacologic, and has no sort of like benzodiazepines or other drug classes like that. Doesn't have a addictive component or an interaction with any sort of kind of current first line treatments. So what we do is we advise patient or doctors or and therapists to try our device with their patients and both so do treat your patients as you would in a first line therapy and then add touch points on and if and when it is appropriate without and not have any sort of fear of complications or problems propping up with that. So, um, yeah.
understood. Just to understand on a general sort of stress relief and sleep level again. Like I have the device for like maybe 3 to 4 weeks now,
Mm-hmm.
and I find it do reduce the level of stress.
Mm-hmm.
But what I find is um, there seems to be, well, I guess the guideline for using the product is quite relaxed.
Mm-hmm.
Like a lot of yeah, it's not like any other medical device.
Yeah.
Like I've been instructed to use it in the morning and in the afternoon. In your case, especially in your patient's case, do they use it on the wrist, or do they use it binding to the ankle or other
Yeah.
part?
The best, although you can, because the vibration, we have several different settings on
Yeah,
the device. So the vibrations can be, again, both very, very gentle up to much more intense. And so, obviously, the most effective way to do it is to affix to the skin, usually been by a wrist device or even held in the hands with the zippered sweatbands we have, but
sure.
as much as possible against the skin and again on both sides of the body. So most of our patients, we have them. They are usually on the wrists is by far the most common place to put them, but also ankles and things like that. For those who are maybe perhaps a little bit self-conscious, again, you can put them on your ankles in those zipper sweatbands, and just as effective on both sides of the leg, both legs. So, yeah.
I have I have a couple other questions before we
Sure.
maybe ask you about the new products already in the market.
Yeah.
Just wondering, like for this type of device, you claim, well, not claim, but it has been used for some tremor relief and
Mhm.
also Parkinson's.
Yes.
Yeah, well, obviously we have seen this FDA approved device. I think it's called I think it's called Kia, or I can't remember. It's a watch looking device to reduce essential tremor.
Mhm.
Is the principle the same regarding neuromodulation and electric stimulation?
We don't believe so, actually. So, obviously, for sort of non-pharmacologic treatments of Parkinsonian disease, you look at deep brain stimulators. This is that you mentioned this device, a much more non-invasive sort of electrical stimulation. Again, our device is a vibrational stimulation, but we have seen um, not too much in essential tremor, but in Parkinson's disease and Parkinsonian, we see a reduction in tremor, bradykinesia, and tremor and bradykinesia, other Parkinsonian symptoms.
I see.
Surprisingly, we actually see it most effective in those Parkinson's disease which have a cognitive component, such as Lewy body disease. So
I
for some
see.
reason, in these patients, we see to be actually almost 1.5 times more effective than in other Parkinsonian patients. So we're not sure precisely why that is, but it is a effect we're exploring. So um,
Yeah, that sounds very promising and interesting.
yeah.
I think just last week, or I think a week ago,
Mhm.
we have a webinar conducted with a relief band, which is
Mhm.
a motion sickness wearable device.
Okay. Yeah.
Um,
Yeah.
yeah. Do you think TouchPoint has some relevance in that part of the therapeutic area as well?
Um, Good question, actually.
Yeah.
Possibly, although we haven't seen, it's a question we actually haven't asked yet. Um, Again, I think that it may not have. Again, it's not electrical stimulation,
No.
or direct vagal nerve stimulator, so it may not be as effective as those devices in
Yeah.
treating motion sickness. But again, it would also reduce stress. It reduces, which is linked to hyperacidity,
Yeah.
which
Yeah.
cause problems, and obviously can exacerbate motion sickness. So in that sense, any reduction of stress, especially with our device, would, I think, be effective, show some efficacy. Yeah.
Thank you very much, Dr. Ashman. So just one final question before I close the floor and close for today.
Sure.
I want to ask you, because, for example, if you are selling a TENS unit or
Mhm.
you're selling something like relief band,
Mhm.
the symptom itself is very evident. Like for example, whether it works or whether it not will be very evident within the first 15 to 30 minutes of using.
Mhm.
Therefore, the call to action and the patient's purchase is the route is very simple. But for something like stress,
Yeah.
it's a lot more abstract. And from your journey as a physician and convincing patients and recommending to patients,
Mhm.
what is the successful way of convincing patients to give this a try? Because this is not um, this part of the world is quite conservative when it comes to wearable device.
Mhm.
So I just wonder, just giving doctors watching and very interested, some courage. Like, what is the first step of communicating with your patients?
Well, I would say in response to that, the touch points is very fast and effective. Usually within the first application, within sometimes as little as 30 seconds, a person can feel stress relief. But we do ask people to kind of or do ask doctors to kind of emphasize that, to have a little bit of patience with the device, because there is this element of this kind of cumulative long-term effect, this rewiring that we see in for these external stressors, and that kind of effect is more cumulative, that happens over time, but is also kind of unique to our device, and very effective, because then it kind of weans patients, you know, weans patients off our device in a sense. So you won't be having to use our device forever. I mean, you can, of course, but again, you're going to see not only that first, like a TENS unit or something, you're going to see that first
Yeah.
sort of immediate amelioration of symptoms, but then over a long term, you're going to see an even further reduction in severity as you kind of rewire these sort of stressors, stressing triggers, and hopefully, I guess in the perfect world, wouldn't even have to use our device anymore after a while. But
Exactly. Thank you very much for that
sure.
insight. I think this part of the world adheres to the U.S. market almost on a one-to-one basis. So whatever USA does, this will tend to follow in the span of 3 to 5 years. So the way I see it, I see a lot of neuromodulation being the hot word in the coming days. So we have seen a plethora of neuromodulation devices being available on the market.
Yeah.
So my last question is regarding other neuromodulation devices versus TouchPoint. For example, like products like Apollo Neuro and a bunch of others, a bunch of other products. How does TouchPoint distinct oneself from others?
Well, yeah, again, Apollo Neuro is one of our main competitors, I guess, if you want to call it competitors here. We would say that we're getting this sort of neuromodulation. Again, I agree that this is going to be quite a buzzword as sort of we go forward, as we begin to see even more optimized treatments or wellness, even biofeedback devices as well that kind of linked into them. But TouchPoints again has that. Apollo Neuro, I believe, doesn't really affect or treat these kind of conditions, these stressors, as on higher brain centers like we do. So Apollo Neuro, I think, again, works much like we work in addition, in sort of in part of our device, in that it does increase parasympathetic tone. But again, we go further. I think when we rewire, sort of give these sort of again, sort of in the cortical connections and these sort of subcortical kind of neuromodulation, we begin to see sort of that's where we kind of stand apart, and that's kind of those parts of where we see the kind of long-term effects of our device over time that I don't think you'll get with Apollo Neuro. So again, we're remodulating the brain, rewiring your brain with our device to reduce these stressful triggers that you have. So eventually, you'll be, the ideal part is that you'll be free of this eventually, which I don't think Apollo Neuro we don't find, or we don't think that Apollo Neuro is effective as we are in that. So.
Understood. Thank you very much. Just to wrap this up, and I have seen no more questions on the floor. Thank you very much, Dr. Hageman. And
thank you so much.
Your academic accomplishment is brilliant, and we might be looking into getting you into one of the speaker roles in upcoming neurological webinars, just to promote this wonderful product. But the way I see it, I think including the concept of EMDR therapy and also the concept of neuromodulation, we still got a long way to go in this part of the world. As the general wellness, we still got a long way to go. There'll be a lot of questions asked in the coming days, which we will rely heavily upon you to answer all of them. So thank you very much for your time, and I hope all the audience today has had a fruitful time with us, and thank you very much for joining on the Doctor 52 episode. In the upcoming episode in May, we have several other wonderful speech and speakers lined up and available in May, as we focus on diagnostic and also continuing our portable ultrasound series. So without further ado, I hope you have a good afternoon, and thank you very much again, Dr. Hageman.
Great, thank you. It's been my pleasure.
For your wonderful time.
Great,
thank you.
Thank you.
All right, cheers. All right.